Hello, yes, please come on in. Yeah, just tell me your first and last names, please. I see here. Yes, you have the reservation, an appointment. Okay, so severe pains, right? Insomnia. You've been feeling anxious. Okay. Have you ever experienced something similar before this episode in your life? And what is your current age? Okay. Yeah, so just let's see today what we can get. Yeah. Have you been trying some new medicine? Yeah, anything from the pharmacy? Okay, and what about your day rhythm? I will just come a bit closer, okay? Yeah. Okay. Now I will use my light pen, okay? And I just want you to focus on this light, okay? Yeah, very beautifully. Do you see it like it's a point? I mean, where from the light comes, or maybe it has some lines. How do you see it? What's the color of this light? Okay, just follow it, okay? Okay. Okay. Yeah, tell me if there is any sensation. Okay. Good. Now I want you to follow my fingers, okay? Do not respond to the light. Just follow my fingers. How long have you been experiencing the headaches? Okay. Focus here now, okay? Okay. You are totally safe here and you can be totally relaxed if only you just are available to do that, okay? I mean, we will examine you, me and my colleagues, okay? And yeah, I can assure you that we are going to help you, okay? So regarding the eyes, just marking some information. Do you do any sports? I see. I will listen to your heart, alright? Because the heartbeat really tells a lot. Okay. Yeah, just breathe normally, okay? Now please take a deep breath in, okay? And hold it, And now breathe out. Again, repeat it. Breathe in. Hold it. Hold. Hold. And breathe out. Any palpitations that disturbs you during the day? I mean, the pulse that's been going faster than usual. Okay. Okay, I'm gonna touch here, okay? Yeah, your collarbone around it. Okay. And here, if you feel any pain, just tell me. Okay, so where does your headache starts from physically? Like it's down your spine and then up. Maybe it has a tendency to show up only on one of the sides of your head. And how are you trying to help yourself? Okay. I will just take a look at your ears, okay? And as you've mentioned this side, I will take a look at it, okay? Yeah, okay, the light is on. Yeah, just checking in. Okay. Is it painful when I touch it here? Okay, and yeah, I got it. Okay. Yeah, it's very interesting. I do believe that it will be related with this lower part of your jaw, okay? That's why I think I will ask the dentist of the clinic to take a look. Alright. Just one last thing. What I'm going to do is I'm gonna palpate a bit, okay? And yeah, just here around your neck a bit, around your ears and your jaw. If you feel any pain, please tell me. Yeah, suffering is good, but it does not mean that you have to suffer in literal physical pain, you know. It shows some kind of disharmony, imbalances in your system. Okay. Now the last thing, I would like you to tell me if I'm touching with this sharp thing, okay? Yeah. Or I'm touching with a brush. Okay. With a soft one. Okay. Let's begin. Okay. Okay, one more time. This point is very interesting for me. Okay. Alright, so let me see what I can suggest to you. Yeah, right now the dentist is available. Just a couple moments, I think she will come and replace me for you, okay? Yeah, good. Yeah, I'm just going to ask her. Alright. Yeah, okay, I'm going to check it, yeah. Hello. So, how have you been feeling? Okay. Is this something new in your life? Or this is the first time that you are experiencing such pain and discomfort? Okay. So when we speak about the dental problems, have you ever experienced recently something that's been bothering you inside your mouth? Okay, and just please inform me regarding the headaches, the toothaches, maybe some tension in your jaw. Okay. Okay. No worries. I will be really gentle today. Okay. So just going to take a look. Is there anything that we have to be worried about? Please open your mouth for me. Okay. Okay. If you feel any discomfort, just please let me know, okay? Yeah, I know it's kind of hot today, so it's hard to breathe for me. Yeah, I just wanted to okay. You know, they usually send when there is something regarding with the head. They send to the dentist. Well, you know, people, doctors who cannot find the reason for your symptom in their sphere. Yeah, it's a very usual practice when specialists say that, you know, all the roots of your pain and symptom begins in your teeth. The problems with your teeth. Yeah, but I see your gums are really, really healthy. Okay, I will be just again testing the sensations. I want to see if there happens any discoloration. Okay, and I'm going to challenge a bit your muscles of your mouth, okay, so of your jaw. So just please tell me if that will be really very painful, okay? Of course, I will try to make this procedure and examination as comfortable as it is possible, okay? As gentle as it is possible. Okay, but just okay. Mm-hmm. Mm-hmm. Good. Right. I'm going to prepare some specific liquid, okay, which I will apply to your gums, okay, just to make sure that everything would feel fresh, clean, and really safe, okay? I mean, I do not see anything that would be as a problem, you know. Your gums are healthy. You have a beautiful smile. And I already have seen on the computer in your files that the doctor sends you to the posture therapist. Like she's a chiropractor. Yeah, so she will take a look at your posture. And that's a very normal, you know, when people can't find the reasons for your pain, they send you to check your teeth and then to check your back, your spine, yeah, because yeah, that's a normal procedure. I would suggest for you just to relax. Okay, so just taking this here. Good. Please open. Right. One more. Okay. Open. Okay. Yeah, you may swallow, that's fine. You may close your mouth. You may try to speak right now. Yes. So these are very natural herbal tinctures. Well, let's put it that way for you to understand it more easily, okay? Yeah, and those this liquid, it just, as I've said, it just brings the freshness, and it like locks, you know, the health of your gums that you have. Yeah. So I think we are done for today, and wish you really lucky another visit. Bye. Hello. So I've seen you quite recently. I remember I was taking your measurements for that beautiful loungewear. And now, what we have right now, misalignments again. So, okay. Yeah. Okay. Just let me go straight to work, okay? Do you have pain anywhere in your body? I want you just to stand normally in a posture that is normal for you, casual, and just breathe normally. Yeah, okay, so these are here 20, 22, I'm sorry if I am too close to you, but that's my job. Okay, 26 and a bit of right. And if I go with that arm here, okay, so this side is more active regarding the pain. Right, just checking. Good. Okay. Good. Yeah, now this side, just to make sure. Get 52. Okay. Yeah, you understand where am I looking, right? Okay, just you can close your eyes if you want to. I will be just going around and observing you, okay? Stepping back and then close to you. All right. It's like, okay, but could you please just for a moment pick up your shoulders like that to your ears? Okay. And then, okay, let it down, please. Relax. Okay. I will go just to your back for a moment. Yeah, I see. They might be really right about it. Yeah. Just going to mark some moments. It's like T3, T6. Have you been injured recently? Any other problems with your back, with your spine, hips maybe, or one of the legs? Okay. Yeah, I'm just checking all the physical information about your body and its experiences, and then you will see our psychosomatic specialist, the therapist, she will give you more information about regarding how the traumas are happening and why our bodies are leaning on one of the sides and so on. But still, I'm not done yet. I need to measure some things. Okay, so just a moment. If I so this, yeah. I see. So there should be here as 22nd. Would you please turn your head to that side? I'll turn it back to me. 8 and S 9 and 1, 2, 3, 4, 5. Okay. All right. Now breathe normally. I will be just going here around. Okay. Take a deep breath in, please. Okay, so 4, 3. Okay, and breathe out. All right. Now we'll come a bit closer just for the face. 3, 4, 5, and okay. And now the head. It feels very strange, you know. I will send everything to you by the email, okay? I just want to make sure that your bone structure and the muscle structure will reach you in a detailed way, okay, with all the explanations. Alright, so I think you are ready to go. I guess that I have everything that I needed. Yeah. Okay. So, yeah, I will just go to my computer and I will invite her to you, okay? Yeah. Have a good day. Hi. I've heard about you and I instantly thought about this relaxing spray. I know it's not very usual in a therapy room, you know, that you have someone who, you know, takes care of the atmosphere. Yeah. Now, just try it. Take a deep breath in. It should calm your system. Yeah, I think it's been a lot for you today to see that many specialists. Okay, so in just a moment I'm going to take a look at your file. Let's see. Okay, that time. It should be with such symptoms really hard to relax. And I mean, have some good rest, yeah. Okay. Okay. Have you been informed about anyone from your relatives that might be going through some similar symptoms, or maybe had exact symptoms in the past? Alright, so I just want to use the pendulum, okay? That's not very standard, I know, but just to make sure that your psychic, your subconscious is not, making fun of this and not trying to save itself from some pain by telling us stories that are not the real reasons, okay? So yeah, I'll just check what kind of healing it needs. Just please tell me your full name. Okay, so I'm just checking if that's, maybe like this, if that is related with emotions. Okay, with the past life. No, it shows that no. And then physical healing, which also is not about it. Okay, so I see that emotional healing, yeah, it's active here. It resonates. Okay. Yeah. Past, present, generational, no, because, okay, I see. So, how are you feeling at this very moment? I know that it's been quite a day for you, but after all, how do you feel? Tired, but something in you is being felt as an energy that stimulates you, yeah? Okay, please introduce me more about your current situation regarding your goals. Any responsibilities that you have, and maybe you are trying to avoid them, or you feel that they are bringing tension to you. Okay. Yeah, definitely, no worries. You can talk about anything that's really bothering you. That's why I'm here for you. Yeah. Yes, exactly. Yeah, because this side is related with such burden. and such topics, I see. Have you tried anything from in the context of the therapy during the last year? I totally understand you, because it really asks for the preparation, readiness to dive into that. It's not an easy process, it's not a fast process, and even though a lot of people, coaches, mentors, even people who are calling themselves neuroscientists, not each and every one, of course, but there is a tendency in this poll that people are offering just for the sake of marketing and popularity. They are offering a very fast healing, fast approaches, reprogramming, and so on. But that's kind of the first layer, and it's more like a manipulation, but for the brain. But when we speak about the soul things, which is the psychic, it requires the bravery to go there and get to know yourself with everything that you are having there, because that's a lot. Every human has a lot, many colors. But yeah, I understand all what you're saying. It really makes it really hard to fall asleep and just rest, and then your system cannot just, it is in the minus when we speak about the resources, yeah? Because in order to dive into the hard topics, you need to have the resource, just the physical resource, not the lack of sleep. So, I think what I am going to do, I'm going to invite you to another session, okay, where the therapist will use the energy healing, okay, maybe something related with the Reiki or radiesthesia. I'm not sure. We will see if she will prescribe for you regarding your condition, okay, what best will work for you. But also in that session it will be included the relaxing facial, okay, just for you to relax. Believe me, she really has something that helps people to drift away. At least half an hour of relaxation, just turning off your brain will work for you. What I'm going to do right now, just because you will be waiting for the session, I will give you some homeopathic remedies, okay? And just a few of them, some for a few weeks, okay? To dissolve it into the water. You see, these are the beans, okay? You dissolve it in the water and you sip it, drink it. It should help you with the relaxation and ability to fall asleep. And of course, listen more for the ASMR. It really benefits your system. Yeah. Okay, so I'm going to put some. Okay. So this will be your magic box. Okay? Yeah, take it please. Yeah, it's yours now. Yeah. And yeah. I think for today this will be it, okay? You will receive an email with a confirmation for your booking. Just some high frequency water to slow your mind down, not rush into the street or anything. It's rather to your aura, this smell, it will bring the sensation of it is as if you were putting on a blanket and just falling asleep into the cloud. Yeah. Okay. Yeah, smell it. Good. Okay. Yeah, you can relax. You can fall asleep if